Out with the old, in with the new. It's been 10 years since we launched the first Cassini. Since then, our dedication to innovation and our consistent progression, together with our vision care partners, has been described as historic, and there's a lot more to come. We recently reached out to some of our valued founding surgeons to learn more about the transition from their first edition devices to the ever-evolving Cassini Ambient. Here's what Dr. Jonathan Solomon says about it.
My name is Jonathan Solomon. I am Medical Director at Solomon Eye Physicians and Surgeons, as well as Clinical Director of the Bowie Vision Institute for Applied Sciences. I've had the unique pleasure of working with the new Cassini Ambient, which in every way is a brand new device meant to help evaluate, manage, and treat individuals by providing the latest in corneal analysis. One of the major changes that has taken place as of late is the application of this device with a brand new camera. And that camera increases and enhances resolution beyond certainly where it was and certainly beyond where all other technology is at this time. And that's going to allow for a much better outcome, obviously, for patients. The other real change that I've noticed in dealing with patients as it relates to the Ambient is that there's been a significant reduction in illumination levels. Any corneal topographer or tomographer, when it's taking images through a photopic management analysis, is going to take a fair amount of light. And one of the things that then takes place is there tends to be a recoil for the patients. Unfortunately, that can reduce the quality of your image, and as we know, garbage in, garbage out, image reduction is going to be impacted. And with the changes that have taken place with Ambient and the reduction of light delivered to the patient at that point, we know that we're going to get a very good quality image and therefore provide us with opportunities to get a great outcome for each and every patient. Another unique advantage of the Cassini Ambient is the reduction in illumination. That impacts both the analysis of the cornea as well as surgical flow or clinical flow. And we all know how important that is when trying to make sure that you're running a profitable clinic. Technical time, technician time is valuable, and one of the things that I think has made this device so much better is we don't have to worry about poor quality images due to a photopic fright. And what I usually mean by that is a bright light coming from a device causing the patient to either recoil or in essence achieve a very poor outcome. And quite honestly, the Cassini Ambient has done away with that by reducing the illumination levels, making sure you get good outcomes, and making sure that our technicians are not working twice as hard for the same level of image quality. And I really do value that as it relates to the Cassini Ambient. One of the unique advantages of the Cassini Ambient is the integration. There's been a move towards integration of different technologies, both preoperatively and intraoperatively over the last decade. And quite frankly, the Cassini Ambient has taken that to a whole new level. Their integration with the LENSAR Ally is not new to me. We've been using this as a standard of care in our clinical practice over the past 5 years, maybe even longer. And what it allows us to do is to take a high quality photo of the cornea and the iris and provide registration through the image to our femtosecond laser and allow for unbelievable accuracy for toric alignment or arcuate incision alignment. And therefore, we are able to reduce the relative error in our outcomes and improve the image quality for our patients postoperatively. Another unique advantage of the Cassini Ambient is their application for registration from the preoperative technology to the surgical theater. And what the Cassini Ambient has done very cleverly is to guide the delivery of care in the operating room. That broad, high quality image, in essence, ensures that there is going to be beautiful registration during the surgical encounter, minimizing any potential error, both from a toric intraocular lens, as well as IOL centration, and of course, arcuate incisions that are going to be provided by a femtosecond laser, specifically the LENSAR Ally, which has already gained approval, which we're very excited to be able to use in the very near future. And that broad, relatively agnostic intervention or communication with regard to the Cassini Ally has given me a great deal of confidence, knowing that I can go from one surgery center to another and not lose any value or certain outcome reduction when applying our surgical procedures as it relates to lens-based interventions.
The easy and seamless upgrade to Cassini Ambient's revolutionary digital vision care platform can raise the bar in your diagnostics and surgical outcomes too. Contact us and let's give your cataract practice the speed, efficiency, and accuracy it deserves. Cassini, the world in vision.